Wildfires can affect air quality. This is true even when a wildfire is not close by. This video will help agricultural producers identify how wildfire smoke can impact their health, how to avoid and reduce exposure to wildfire smoke, and how to protect other people working on the farm, ranch, or dairy. During a wildfire, the air becomes dark and it has a strong smell. This is because the air is full of harmful chemicals and particles from the things being burned: trees, vegetation, structures, and everything else in the fire's path. The smoke particles in the air are very small, smaller than the diameter of a human hair. We know they are there because the air changes color, but we are not able to distinguish each of the particles with our eyes. The size of the particles is important because those that are very small, called PM 2.5, can enter our blood through the lungs and affect our health. During a wildfire event, you may experience health impacts such as burning eyes, runny nose, chest pain, fatigue, coughing, wheezing, difficulty breathing, worsening of asthma, or a rapid heartbeat. Wildfire smoke can negatively impact everyone, but some people have a higher risk of experiencing these symptoms, such as older people, pregnant women, people with heart and lung problems, and people with asthma, diabetes, or chronic bronchitis. Air quality is reported to the public using a scale called the Air Quality Index, or AQI. There are different categories in the scale, from good to hazardous, based on how polluted the air is and who is most likely to be affected. Your state health department, or Department of Environmental Quality, tracks and reports the AQI. You can also look up the AQI for any location at airnow.gov. During a wildfire event, you will need to monitor the AQI before and while working. The air is considered unhealthy when the air reaches 151, the unhealthy level, red in this chart. This is the point when you need to take action to protect your health and the health of those working on your operation. It's important to remember that some people may fall in the sensitive category, especially those with conditions like asthma or chronic bronchitis. Action should be taken when the AQI is lower for these individuals. Action should also be taken whenever someone begins to feel sick or have difficulty breathing, regardless of the AQI. When you check the AQI, you may notice that many locations, especially rural locations, are not near an AQI monitor. Due to variations in weather and landscapes, the AQI at the monitor location nearest you may not accurately reflect the air quality where you are. If this is the case, you can utilize visibility to approximate the AQI and determine your action levels. Public health and air quality monitoring agencies recommend taking action when visibility is reduced to 5 miles. The first thing to consider when the air quality reaches an action level is if tasks can be delayed, rearranged, or altered to avoid being outside. In addition to reporting the current and forecasted AQI, many air quality reporting sites also provide a smoke outlook report describing anticipated changes in smoke over the next day or several days. Unfortunately, due to the task required to maintain ranches, dairies, and farms, you may not be able to go inside and avoid wildfire smoke. When this is the case, your next best protection is to wear an N95 respirator to filter the air and reduce the number of particles you breathe in. An N95 respirator, also called a filtering facepiece respirator, is made of filtering material able to stop some of the small particles in wildfire smoke. Surgical masks, bandanas, and cloth face coverings will not stop the small particles because the weave of these fabrics is too large. Even a bandana, folded 2 or more times, does not protect you from wildfire smoke particles. An N95 also provides protection from COVID-19. While wearing an N95, you do not need to wear any other face coverings to prevent the spread of the virus. To be effective, an N95 needs to be put on and worn properly. The end of this video includes a demonstration on how to properly put on and check the seal of an N95. These respirators are intended to be disposable, and they should be thrown away after 8 hours of use or sooner if the mask becomes dirty, wet, or difficult to breathe through. Facial hair, scars, and acne can affect the ability to create a seal. Click the link in the video description for more information on what facial hair is compatible with a respirator. The Occupational Safety and Health Administration, or OSHA, does not require an N95 to be worn during wildfire events. Thus, choosing to wear one is considered voluntary use. OSHA does not require a written respiratory protection program for voluntary use of only filtering facepiece respirators. Even so, consider including wildfire smoke hazards in your respiratory protection plan and ensuring that you and anyone who works on your operation is evaluated and approved by a healthcare provider to wear a respirator. When the air quality reaches an action level, you should also take steps to prevent the smoke particles from entering indoor spaces. This includes closing windows and running the fan of your furnace or air conditioning unit continuously. Install a high-efficiency filter on your fan and replace it more frequently, once a month, during wildfire season. HEPA-certified portable air cleaners can also be used indoors, but you should avoid electrostatic air cleaners. Wildfire smoke also impacts the health of livestock. During poor air quality, limit strenuous activity for animals and make sure they have plenty of fresh water. Prepare and regularly review a wildfire evacuation plan that includes your family, employees, livestock, and any pets. Evacuation can be stressful, so it's especially important to practice low-stress animal handling techniques during these times to avoid additional injuries. You can find additional information on protecting yourself and your employees from the High Plains Intermountain and Western Center for Agricultural Health and Safety. The Western Center has a selection of robust resources for implementing a program to protect ag workers from wildfire smoke in compliance with Cal OSHA regulations. Colorado State University Extension also has several documents to help you prepare for and recover from disasters like wildfires. These links are provided in the video description below. Track wildfire events and smoke advisories through your local public health, emergency management, and environmental regulation agencies. This video was produced by the High Plains Intermountain Center for Agricultural Health and Safety at Colorado State University with collaboration from several regional partners. Special thanks to the Western Center for Agricultural Health and Safety at the University of California, Davis. Keep watching for a demonstration on how to correctly put on and check the seal of an N95 respirator. To put on an N95, cup it in your hand with the straps hanging down. Place the mask over your nose and mouth with the metal nose clip on top. Pull the top strap over your head so that it rests on the crown of your head above your ears. Then pull the bottom strap over your head until it rests just below your ears. Some masks allow you to tighten the straps by pulling on the free end of the strap where it meets the mask. Using both hands, starting at the top, mold the metal nose clip around your nose to achieve a secure seal. To make sure the N95 is on properly, you will need to conduct seal checks every time you wear a mask. You also want to conduct seal checks whenever you adjust the mask on your face. To conduct a positive pressure seal check, place both hands completely over the respirator and exhale. The respirator should bulge slightly, and you should not feel any air escape around the seal. If air does escape, readjust the respirator on your face. Make sure the metal nose clip is contoured firmly to the shape of your nose, and check again. To conduct a negative pressure seal check, place both hands over the respirator and inhale quickly. The respirator should collapse slightly. If air leaks between the face and the seal of the respirator, readjust and check again. If you do not pass both of these checks, you are not protected. Additionally, remember to always wash your hands before putting on and after removing any personal protective equipment.